gonna gather my supplies. So I have a pill cup, pill cutter, and gloves. Enter my patient's room. Hi, I'm Paige. I'm your student nurse today. Can I have your name and date of birth?
Madison Clower, A1304.
I'm gonna check your wristband. Perfect. Do you have any allergies?
Nope.
I don't need PPE right now, but I will later. We're gonna give you some medication later today. And do you prefer to take your meds orally with water and Whole is okay?
Yep.
Okay. And I'm gonna take your blood pressure. Came back, it was 126/80. So that was good. Do you have any pain today?
No.
All right. Do you need anything before I go?
Nope.
All right. I'm gonna compare my provider orders to my MAR. So Joe Smith, digoxin, 0.125 milligrams, 0.125 milligrams by mouth, daily, for CHF and AFib, status is active and it's not been given. Joe Smith, furosemide, 40 milligrams, by mouth, twice a day, for CHF, status is active and it's not been given. Warfarin, or Joe Smith, warfarin, 5 milligrams, by mouth, daily, for atrial fibrillation, status is active and it's not been given. Joe Smith, oxycodone 5 milligrams, acetaminophen 325 milligrams, 325 milligrams, one tablet, by mouth, every 4 hours as needed, for pain rating of 1 to 4, status is active and it's not been given. Joe Smith, oxycodone 5 milligrams, acetaminophen 325 milligrams, 2 tablets by mouth, every 4 hours as needed, for pain rating of 5 to 10, status is active and it's not been given. I'm going to put away my provider orders. And my nursing considerations for oxycodone acetaminophen. We're going to assess for pain, monitor vitals. We're going to check monitor respirations, look or ask about alcohol use and if they are pregnant. The pain rating for the patient was 0, so we are going to hold this medication. This is given for a pain rating of 1 to 4 or 5 to 10. Warfarin. Nursing considerations, we're monitoring labs like INR, assess for bleeding, no use if pregnant or breastfeeding, and we're monitoring blood pressure. The INR needs to be between 2 and 3, and our INR today was 3.4, so we're going to hold this medication as well. Digoxin, our nursing considerations are monitoring EKG continuously. Apical pulse needs to be taken for a full minute before giving the med. And it needs to be above 60. We're monitoring input and output, and we're assessing for edema. Our digoxin lab level needs to be between 0.8 and 2. And our lab today was 1.2, so we're going to be holding that medication today. And furosemide, our nursing considerations are monitor for RAS, Stevens-Johnson syndrome, erythema multiforme may occur, and monitoring fluid levels. Lab results need to be within 3.5 and 5.3. That is a potassium level. Ours is... Ours is 5, so we're going to give this today. So I'm going to do my first med check. Take it out so you Lasix, or furosemide and furosemide. Joe Smith, furosemide, 40 milligrams. This is 20 milligrams, so we're going to do 2 tablets of the 20 milligrams. Twice a day, by mouth, for CHF, the expiration is 08 of 2038, and package is intact and no rips or tears, and the status is active and it's not been given. Joe Smith, furosemide, 40 milligrams. This is 20 milligrams, and this is our second 20 milligrams of the total 40 milligram dose. By mouth, twice a day, for CHF. Order is active and it's not been given. The expiration is 04 of this is 04 of 2041. So then the package is intact and there's no rips or tears. So my second check, Joe Smith, furosemide, 40 milligrams. This is 20 milligrams, so we're doing 2 doses of our 20 milligram tablets. By mouth, twice a day, for CHF. Status is active and it's not been given. Package is intact, no rips or tears, and the expiration date is 04 of 2041. Joe Smith, furosemide, 40 milligrams. This is 20 milligrams. This is our second pill of our 40 milligram dose. By mouth, twice a day, for CHF. Status is active and it's not been given. Expiration 08 of 2038, and package is intact and it is no rips or tears. And I was supposed to say Joe Smith before that one. Okay. Here. Enter the room. Hi, I'm back. Paige, with your suit nurse. Can I have your name and date of birth?
Madison Clower, 8/13/04.
All right, provide privacy. I will not eat gloves right this minute, but I will later. I'm back to give you your medications. We're going to give you furosemide today. Do you have any allergies?
Nope.
All right, I'm going to check your wristband. Perfect. So furosemide, it's going to increase your urine output. Some possible side effects are going to be headache, fatigue, vertigo, orthostatic hypertension, possibly some weakness. Do you have any questions? And can you teach that back to me?
It's going to make me pee, and it'll give me orthostatic hypotension.
Perfect. Third check. Joe Smith, furosemide, 40 milligrams. This is 20 milligrams. We're going to do 2 doses of 20 to equal 40 milligrams. By mouth, twice a day, for CHF. Status is active and it's not been given. Package is intact, no rips or tears, and the expiration is 04/2041. Our second dose of 20 milligrams is furosemide, Joe Smith, furosemide, 40 milligrams, 20 milligrams, which is our second dose to equal 40. By mouth, twice a day, for CHF. Status is active and it's not been given. And these were both for Joe Smith. And 2. Are you comfortable?
Yep.
And do you have any questions before we begin?
Nope.
The pair of these in front of my patient. give them to my patient, have her take them in front of me. Perfect. And I will check back in 30 minutes, checking for any signs of adverse reactions or side effects. If they were to occur or be present, I would hold further doses, assess vitals, notify the prescriber and the pharmacy, and document according to agency policy. Do you need anything before I leave? I am going to document according to any abnormalities according to agency policy. I'm going to document in my MAR. I'm going to circle what I held. And do you need anything before I go? All right, that is locked and lowered. The call light's within reach. The railings are secured. The bedside table is within reach. And the floor is full from any fall risks. I'm gonna clean up my supplies and document my findings according to agency policy in my OneNote.